Well, I had a paper, and I don't know.
Welcome, everyone.
Okay.
Good to see you on this beautiful spring day. So I'll go ahead and call the meeting to order. And Amy, would you please call the roll?
Dr. Jones,
Here.
Kathy Emanuel,
Here.
David Thies,
Here.
Dr. Reichstack,
Here.
Dr. Goodley,
Here.
Dr. Hicks,
Here.
Dr. Vera Weiss,
Here.
Dr. Peterson.
Here.
Great to see everybody. Okay, we'll move forward with our first agenda item, which is the approval of the agenda. Moved by David. Do I have a second?
Second.
Second by Dr. Vera Weiss, and then also by Dr. Peterson. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. Our next agenda item is approval of the minutes from November's and January's meeting, November 16, 2023, and our January 25th special meeting of 2024.
So moved.
Moved both minutes? Yeah. Okay. Moved and seconded? Kathy and then Dr. Vera Weiss. Any discussion? Additions, changes to either of those minutes? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. Do we have any public participation on agenda items?
I'm just here in case anyone has questions on our report.
Good to see you, and correspondence and communication, Julie.
Well, I just wanted to let you know that last week we had the old mobile unit that we just sold to Francis Nelson of Promise Healthcare for $1. And then we had the large mobile, which we sold to Dream. You know what that is? We sold it to them for $1. And then the little mobile, or the little pull-behind trailer, we sold for $1 to Solar Russia Farms. So rather than selling it for something, we made sure it went to some place in the community where it can be reused. So that's pretty cool. And our new mobile is here. It's not wrapped yet. Once it's wrapped and looking festive, then we'll hire the same guy who did our mural out there to do the mobile. So why not?
It was just getting, it was too old, or just getting new replacements, is that what it was?
Yeah. That's a long story.
Okay.
That was from during COVID. We had written a grant to get a new mobile during COVID when people were all about that. It just came in. So, but
my gosh.
we won't get into all that drama. But anyway, we did not need another one. So notice we did not sell that one to Francis Nelson for $1, but we did sell them the older one. But it's still good. And the other thing is environmental health. Received their compliance letters, like a year later from the state, but they were in substantial compliance on everything, so that was good.
Was it green? Was it in green when you got it?
Was one in green.
And is there a compliance letter?
Like the restaurants.
That would be nice if they did that, but no. We just kept asking for it. I think it was over a year. Like, where's the letter? You know, you're supposed to have those, but anyway, so that was good.
Thank you.
And
Any
that's
questions
the end
for
of that.
Julie? Is there any questions for Julie? Please speak up if I don't see you. I know we're kind of in a line here, so. feel free.
We're violating our conversation.
I can't see everybody.
Conversation.
Conversation bin, or whatever you want to call it.
Thank you. Our next agenda item is our reports. And we have monthly reports from October through February. So October 2023 through February 2024. So I would entertain a motion for placing all of those reports on file, or we can speak about anyone individually if anyone so chooses.
Move best all.
Moved by David, do we have a second?
Sure.
Moved and seconded.
I noticed there was some COVID money in there.
What?
Or maybe it's the, yeah. Oh, that's Smile, okay, excuse me. No, that's the next agenda. Yeah. No,
So you're talking about the invoices, right?
Yeah, those are the
Yeah.
invoices, yeah.
The CPG
Yeah.
invoices.
Yeah,
that's-
I'm ahead of myself.
You're okay. Any other questions, discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? And then we do have approval of invoices. We have amounts payable to the Child Dental Access Program in items under G 6, 7, 8, 9, and 10. So again, I would entertain a motion for moving all of those for approval, unless anyone would like to speak about any one of those individually.
I'll move approval for payment of all of them, and then we can talk about it if we need to. I'll move approval.
Perfect. Move, do we have a second? Second by Dr. Vera Weiss. Any discussion?
Are we satisfied that the breakout of the county and city is adequate in those?
What are you talking about, the reports?
Yeah,
The number of people served.
number of people served. There probably ought to be a line about county and city. There's a total, and then it does break out into Savoy and Rantoul, but there isn't a total, I don't think. I'm not carrying that agenda, that whole package.
Yeah, well, we definitely keep services by, zip code, so.
But I wonder if we could, yeah, that's what it looks like. Yeah, that's the total number of all programs. So we had talked about separating the county aspect of the contract from Champaign-Urbana.
So what you're saying is I think what you're saying, Lisa, is another column that says here is the amount, the allocation of the amount, so that it's kind of like a unit price of how many of those people were served for that amount. Is that possible in the, what's that?
I don't think, are you talking about us or them?
Them.
Oh, because I'm like, what are you talking about? I was like, okay, I'm sorry.
No, you're fine.
I was like.
There is a lot of discussion of us and them, but we're not talking about it.
So you just wanted to highlight more the breakout of the kids served outside of.
Outside of Champaign-Urbana.
Yeah.
That we're covered, our contract covered.
Yes.
Right, okay. Thank you.
Thank you. Any other questions? Hearing none, all those in favor? Aye. Anyone opposed or any abstentions? Thank you. That takes us to item H, which would be approval of the CUPHD invoices for October 2023, November 2023, December, and then January 2024. And again, we could move to approve all of those as one item all together, and then break out any that anyone wishes to discuss.
So moved.
Moved by Dr. Vera Weiss. Is there a second?
I'll second.
Moved and seconded. Any discussion?
Now, there's COVID money in one of those. So, okay, does that make any sense to me? Why is the COVID vaccination money, I thought it was?
Well, because the grant was probably extended into just vaccination. I don't have Candy here, but, so what happens a lot of times is when they are finishing up a grant like COVID vaccines, we're still giving them, but not like we were, obviously. So then it would allow it to go into other vaccination services, is my guess. But Candy is not here, so I'll have to, or it's
Yeah,
Brandon, not
41,000,
Candy.
yeah.
Brandon?
It's empty on the rest.
Just Brandon and Candy.
Yeah.
So
But-
you are still giving vaccinations out of here
Yeah, oh yeah, we always give vaccinations.
For COVID.
for COVID?
Yeah. Yeah. But the COVID money is probably just ending up a grant, so.
Just finishing up something.
Yeah, and I would have to look at it to be specific, but sometimes at the end of the grant, we're able to buy, freezers or, things to, little coolers to move the vaccine with, or supplies and things like that, so it could be that too. I just don't have that. in front of me,
So
but,
what he was looking at was the 41,832 in December, and it says,
yeah, that's mostly personnel.
and it says COVID-19 vaccination grant.
We won't expect to see that again. No.
No, maybe if you're lucky, we can see H5N1. God.
Knock on wood.
Yeah, that's getting a little iffy, a little
We
sketchy
do have a
out
measles
there.
outbreak right now in Chicago, so, great.
Oh, yes.
Great.
Yeah. Yep.
Yeah. If
The
that's
good, the
not-
good thing is, and I will tell you this, that our county, in the schools, we're pretty decently vaccinated. You know, you have to be over, I think it's almost 98%, 95% for measles to prevent any type of an outbreak situation, vaccination. We have a few schools that are not there yet and may not ever get there, but for the most part, our schools are pretty good.
All a parent has to see is the result of measles encephalitis.
One would think, but.
Yeah.
One would think, but yet here we are again, and why anybody would put their kid at risk, I do not understand that. Measles encephalitis, or, you know, all the pneumonia, all kinds of stuff. I don't understand it, and it's frustrating, but there you have it. We've had a couple, do have experience dealing with measles outbreak. It was at U of I.
2018.
Mhm. And, so, you know, we have
Is
that.
that waning immunity or
No.
non-vaccination?
That was non-vaccination,
Wow.
which was a surprise to everyone. That's a whole nother. But anyway, so that was, yes, it was non-vaccination, and why people that are non-vaccinated travel, I don't understand either. And then they're surprised when they, you know, places that don't have vaccination, that would love to have vaccination, don't have it, and then they come back with it.
Come back with a gift.
Come back with a gift that keeps giving.
And in fact, the list is huge if you're contemplating third world transfer.
Mhm.
The list of vaccinations is absolutely huge.
Yeah, but the U of I does stay on top of their vaccinations really well. But, you know, if you get something in, you're not necessarily going to verify the veracity of it. But,
Well, and the other part with measles specifically is how many physicians today have diagnosed measles? Not very many.
Not very many.
No.
So that makes it difficult
Right.
to recognize it early. Plus, measles is a virus that has a replication number of 12, which means
12 to
each,
18.
yeah, it depends on the conditions, but that means that one person can infect 12 to 18 other people, whereas, you know, epidemic flu is like 1.2. So all it takes to spread is a number over 1. And the goal with vaccination and with all the other measures is to bring the number under 1, no matter what the virus is. But when you just have to be, you know, look at a picture of somebody with measles and you can catch it. you
and
know,
it hangs
that's a
in the
big
air for
deal.
2 hours, which makes contact tracing a real treat.
Yeah.
So,
Well, and students returned yesterday, so it's here.
yeah.
We-
Oh,
we'll
yes,
hear about it.
we're getting lots and lots and lots of calls, with me, you know, doctors, because they've never seen measles.
Yeah.
Any little rash, they're gonna be, you know, thinking measles now, but, there are.
Is there a quick office test for it?
No,
No.
Yeah.
there's not a quick one. They have, but if they even have a suspect one, they contact us immediately, and then based on a variety of things, just, you know, like the situation, because a lot of times, I mean, there's like no likelihood that it could be, and they're vaccinated, so it's probably not that. But, will we end up getting one? I don't know. It's certainly, you know, certainly possible. It is a spreader, for sure.
Any other questions? All those in favor of
Aye.
approving the invoices?
All right.
Anyone opposed or any abstentions? Thank you. That takes us to line item H5, Champaign County contracts. The sub-recipient agreement between the County of Champaign and the Champaign County Health Department and the Champaign-Urbana Public Health District for grant strengthening Illinois Public Health Administration. These are your items 21 through 67. Julie, anything you want to say about
No,
this?
this is a grant that I never thought I would see in my entire life. It's called SIPA, but it is for recruitment and retention. Recruitment, we don't have an issue with for the most part. Retention, we do. So the program that they came up with, looking at all the data that we have, is help me out here, Whitney and Amy. But we looked at the data, and so, you know, we'd have no trouble necessarily recruiting, but then you get to like year, what is it, 3? You get to year 3 and people leave. So we've got a bonus in there of 3,000. And then at year 7, okay, look at me, doing something without notes.
It's
Year
2
s-
and 3,000. So
Okay,
5
and then
total.
then it's at year 7, then they get another 2,000, or vice versa. And then for a total of 5,000, and then at year 10, of course, you're vetted in IMRF, so that's, or vested, I mean, in IMRF. So that kind of helps us to have a little track going down the road, and it's a good thing. But I can't believe we even got a grant like that. 'Cause that just doesn't happen in public health world ever, so.
Now, we discussed this last regular meeting, did we not?
Mhm.
And did we approve it last regular meeting?
I thought so, but.
I thought so too.
Yeah.
Well, I think we talked about it, but we didn't have like the final, because it was back at the state's attorney and.
Oh, okay,
They
yeah,
were looking
that
at.
could be.
So, yes, so now we have to do, you know, we kind of had a discussion, but now we have to do the formal approval.
Is it, It's a source of retention for all staff or certain categories?
All staff, because, and we looked at it,
Nice.
and it's across the board, so, and it was actually used as like a retention bonus for everybody that had met those years, so it was quite popular, because again, like I said, you just don't get bonuses in public health, ever, so.
Is it federal, Julie? I'm just curious.
It was,
It's
no,
federal.
I'm sure it wasn't, but I don't know, but it came through the state, it's part of that. But the good thing about it is that CUPHD is gonna continue doing it moving forward. So when the grant's done, it doesn't matter, that's our new policy, so we will continue doing that.
Yeah, it's a CDC grant, just to answer your question, Lisa, CDC assisting, listing program title collaboration with academia to strengthen public health workforce capacity and assistance grant.
Nice.
My apologies, someone down there was gonna say something.
I couldn't hear, you said CDC, I couldn't tell what you said. So what happens if somebody's been here, is already retained?
They got the
They dig in,
bonus.
so if somebody's been here 7 years,
We
they
caught
get their
every
2-year
single
one and-
person up, exactly, every single person.
So that's the big upfront cost.
That was yes,
Yeah.
that's what the grant was used for that, and then the agency's gonna continue it, moving forward.
When you say the agency, which agency, do you mean CDC?
No, CPHD.
Oh, really?
That's part of our
It's
our
part of your
retention
budget?
plan.
Mhm.
Which is, I'm sure, what the intention was of the grant, is to like make people think about that, because public health doesn't think about bonuses, because that's just not a thing. And so to be able to, you know, do this grant up front and really look at the data and decide, you know, what worked.
And the grant's 350,000, is that right?
Mhm.
And that's enough to catch everybody up? Is there excess then?
Yeah, it'll go into the, you know, the remaining people, because there were people that are getting ready to turn into 7 years, and there are people that are getting ready to turn 2 years. So they didn't get it ahead of time, you have to meet that. I want my freaking 30-year bonus, what's that? Come on now. My pre-pandemic bonus, come on.
When you figure out what that is, you let me know, maybe I'll come back.
Exactly. No, so that was, yeah, it was really great, and it allowed us to really take the time, and a lot of staff time, and look at that. Like what are the things that keep people, and why do they leave, and We don't know why they leave at 3 exactly, but they do.
Do they go for other work in similar agencies or what?
You know, we have a lot of, at Public Health, we have, one of our highest turnovers is dietitians still, correct? Yeah. And nutritionists, they come here, they graduate, they come here because we'll take them right out of school and then they get training and then they leave. That's just how it's always gonna be probably, unless this can somehow entice them, but they go to, you know, hospitals or long-term care or any number of places, so. They start out in the WIC program and then so for the rest of it, it's not, we don't have, like for intake specialists, for example, we have no issue recruiting there or retaining. So there's just different categories, but it's across the board.
And I think the public health background is a good thing to have on your resume, because it
Yes.
helps to get the next job, but we don't want it just helping them get the next job.
Yeah.
Any other questions? And then, all those in favor?
Aye.
Anyone opposed or any abstentions? Our next two agenda items, 6 and 7 under H, are CUPHD reportable disease and performance management reports. So I would entertain a motion to place those on file. Moved by David, is there a second? Second by Fred. Moved and seconded, any additional discussion, questions? Hearing none, all those in favor?
Aye.
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 Anyone opposed? Any abstentions? Thank you. Then that takes us to an update on our sexual health education program.
Everyone's favorite part. We're chugging along, which is really great. I know at the last meeting I shared that Ludlow was no longer interested in partnering with us, which is still the case. We plan to poke them again next school year, so next fall, to see if they'd like to participate. Hopefully there's maybe a change in administration or something there that can get our foot in the door. The rest of this year, the rest of the school year, I should say, we're gonna be at Fisher High School with another cohort of freshmen. And we're also gonna be at Rise Academy, which is the new alternative school and RAIN tool. It used to be Thompson Learning Academy, so I think this is kind of the same idea. So we're gonna have, I think, about 12 students there, doing a mix of sexual health education and some puberty education with the younger group there. And that's gonna round out the rest of the year, and we're gonna see about 350 students this calendar year.
If anyone knows anybody at the Ludlow School Board or whatever, Ludlow could really use this.
Yeah.
What was the reason they gave for not wanting to be?
So we had contact with the student services director, I believe was their title, and they had just said that the principal administration was not interested in partnering at this time. So I don't know if that was just not interested across the board, or they had staffing issues or whatnot, but we plan to reapproach them to see if that maybe has changed.
Might be worth kind of do an exit interview. I mean, rather than waiting until you ask to come back, have a meeting and ask the principal why not.
Yeah, we could definitely do that.
That's not a bad idea.
Mhm. Yeah, that's our update.
Any questions for you?
Well, the thing we talked about last time was that finding some way to make this self-sustaining.
Having the schools pay for it.
Yeah.
That would be great. I don't know that will happen.
Well,
The
what
one thing
we're
we could
funding
do-
is coming out of our carryover.
Yes, yeah.
And that's not gonna be forever.
Right, and I don't know that the schools would pay us to do it, but there's definitely an assurance role that we could play, and, you know, we could provide technical assistance to the teachers that are gonna be teaching the content, if they choose to do that. But we've done that with other schools that have PE and health teachers that have the comfort level of teaching that subject, so that is something we could do.
Any other questions? Thank you very much.
Yeah, thank you.
Appreciate it. That takes us to our last agenda item under old business, an update on long-term care beds in Champaign County.
Okay, I have a little report on it here. The provider and consumer surveys closed this week on March 15th. Robert and Zahid are working with the 8AC group on the analysis and drafting of the report. We're expecting the report to be ready around the second week of April. The consumer survey had 881 viable responses, which exceeded the target, which is good. Those are viable ones, so that's not ones that were started, not finished, or, this is more than double the number of responses recorded than what we needed for our sample size. 97% of the respondents are from Champaign County, 3% from outside Champaign County. 86% of the respondents came from single-family homes and private residents. The rest come from congregate settings, supported living, assisted living, seniors and seniors with a disability. For seniors and seniors with a disability, about 10% provide care to family members and friends. And the specialized health conditions of the seniors included 35% had mobility issues, 24% had vision and hearing impairment, 19% had memory-related issues. As expected, which always happens, males are slightly underrepresented. Respondents make up about 30% male and 68% female. 91% identify as white, 2% black, 1 Asian, and 1 Hispanic or Latino. And then for the provider survey, 58 responses were received from providers, so that means that our target was met. 33 or 57% of the providers are tasked with placing patients. 25 or 43% were tasked with admitting patients. Facilities represented include Carl Foundation Hospital, and the rest were from assisted, senior, or independent living. Of the providers who responded, 21% or 12 were social workers, 22% or 13 were physicians. That's a high, yeah, y'all are not known for taking surveys, so that's a really high, right? I think that's pretty good. 16% were case managers, 22% were healthcare administrators, and 9% were nurses. So I think Kathy getting out there and stirring them up got the physicians to, got physicians to respond, so that was pretty good.
Yeah, it wasn't me, but it was somebody on AAC.
So, yeah, so that's really good, and the working with the group has worked out, it's worked out really nicely, and the community connections are great, so we might task you with helping us with the I-plan when it comes around.
No, I wonder if the other point I want to make sure we bring up is we passed as a board, we approved an expenditure for $20,000 for a market study several months ago. I can't remember exactly when. Anyway, we put out an RFP for the market study. We got good responses. We interviewed people. And by we, it's this community collaborative, and we selected a consultant who only deals with not-for-profit senior housing and nursing homes, and they work with companies all across the United States. And we all, as a board, approved $20,000 for the market study. The market study proposals came in at $25,000, and then was added expenses. We've gone to county board and some other places to get the additional funds, and we think we're going to get the additional funds that are needed this month. We've had some indication from the county board that they have some ARPA money that they could give us for what might be an additional $15,000. But what I want to do is say, okay, we need to sign a contract with these guys now, so we need the $20,000 that we approved, and I don't know how to get that. And nothing else has to happen here to do that, right? Because it was approved.
No, I just tell you. Well, yeah, or me or finance, and,
Okay.
and who to, we'll need something, who to pay it to, and,
Okay.
yep.
Okay, well, we'll be right on.
Just get us a contract or whatever you get with them, and then put in for payment. Just send it to me.
And we still have, I don't know if any of you are experiencing, we still have the same situation in terms of the shortage of beds. I just had a friend who got discharged from Carl, and they said, there's no place for you to go here, try Gifford. So we've got the same situation.
Did they get into Gifford? 'Cause it's been
Actually,
pretty
they couldn't
bad.
get into Gifford,
No,
either
I was
they
gonna
ended
say.
up which was really interesting to me. They ended up at Windsor Assisted Living. And assisted living there will provide more services than I thought they were able to provide, but I'm sure they are able to provide them or they wouldn't be doing it. So anyway, but we've still got the same problem. We've gotten a lot of support from the county board at this point. We made a proposed presentation to them, kind of telling them what was going on, and we had a bunch of calls saying, okay, we want to help with your effort. So we're getting a lot of good support on moving forward with the effort. So the next thing that we will do is we'll sign, I hope we sign this contract with the consultant this week. They'll have their work done in 4 to 6 weeks. Then the next thing we do, and they work with all, as I say, all not-for-profit, and there's a bunch of them, in Indiana and Wisconsin and Missouri and Illinois and the Chicago area, and then they would kind of try to help us find an owner or operator that would come into the community. And the next thing we'll start to do is try to get a business plan. And the business plan will be expensive, and a certificate of need will be expensive, and we're applying for grant funds at various places to try to get that. So we're moving ahead. So
But
we
you're
really
also
appreciate-
talking to the county board about them going to the bank, correct? Are you still doing that?
We asked the county board for money for the market study,
Mhm.
and then we did, oh, yes,
Yeah.
I know what you're talking about, yes, Joyce. So, yeah, so you know that the county has to make a decision about lifting the deed restriction on the nursing home. And and because the owner walked away from it, the bank owns it now. And the bank says that they don't have any buyers who are nursing homes, which is pretty typical because across the country right now, nursing homes are closing like crazy because of what a tough industry it is. And so they asked the county board to lift the restriction. And we went to the county board and said, if you're gonna lift the restriction, why don't you ask the bank to pay you something? I mean, they entered into the mortgage with the previous owner knowing that there was a restriction on it like that. So when the restriction comes into play, as one of the lawyers on our group said, they shouldn't just say, okay, we didn't mean it, we didn't really want to have the restriction. And they said, okay, we'll lift it, but here's what we would like in compensation for lifting it, because we know that we put it in place to protect the public and the older population, and we're not going to be able to do that now, and can you provide some compensation to let us lift it? And the bank is owned by Vanguard. So right now the county board is negotiating with the bank on whether or not they can get any compensation for lifting the restriction, and they're gonna.
It would be especially good if they can say, well, we're gonna have this, study come in or
business
this.
plan.
Yeah, we need a business plan, or we need a certificate of need or whatever, and this is what it's gonna cost, so that would help us out. Then you can just do whatever you want with your
Right,
property.
what Julie's saying is exactly what we went to the county board and asked, and we, it's a $10 million mortgage. So if they can't get out of it till 2027, they've got the carrying cost of that $10 million mortgage, plus they are paying somebody to maintain that property so that it doesn't, lose even more value.
Well, I'm not going on break off.
Now, they might not, but at least.
Does the county own that land?
Mm-hmm.
Yeah.
I think the county's gonna be quite reluctant to sell it to a private party in that complex of all public land. That's an interesting question.
They already did.
Yeah.
It's
did,
gone.
sold it.
They don't own it anymore. They sold it to this
Right.
guy. They put the
That's right.
restriction on it saying that it has to remain in long-term care facility. And now then the guy walked away from it, and now the bank owns it, so.
Yeah, county doesn't own it anymore, they just have the land, right?
Yeah.
So that they
So
want to sell it
be
to
ready
get
for
out
a
of it.
Taco Bell over there.
Well, yeah, or a gas station or something, yeah.
Right.
The other option would be just to tear the damn thing down and give it to sell it to the park.
But even there, the bank should do that, it shouldn't have to be
Yeah.
up to, because
Oh,
public health
right.
doesn't own it
Yep,
anymore.
it's the bank owns it, so.
It's a great opportunity if somebody figures out how to make money doing a nursing home and goes, you get a really great deal, and it would be the beginning of a new paradigm.
Right, if I understand you correctly, that's what we were proposing, we said, get them, since it was for a nursing home and you can't get it, give us enough money so that we can do the business plan and the CON, And that would serve as an incentive to bring in a new owner and operator in a new facility and being able to provide something that is contemporary, which we do not have in this community. And why would they not have to pay for that when they're the ones who've taken on this obligation? And we would for freeing them of that restriction. Right, that's exactly what we were hoping for.
I'm just curious how one walks away from a $10 million loan.
And the back taxes.
I wonder what would happen if one of us tried to walk away from a loan.
Right. This is not the first one he's walked away
Not a
from.
recourse setting. There's a lot of ways you could have set it up originally.
Right, and the county was warned about his history
Oh,
by
yeah.
Claudia Lenhoff.
He had walked away from them before. Right.
Yeah. Yep.
And of course, the county is incurring lots of legal costs. What they're interested in, when we talk with them, is they said, look, we just want to get our legal costs out of this. And we said, we think you should be more ambitious than that. See if you can't get more than your legal costs. Get some costs to help the community have the services that aren't going to be able to be available anymore.
At least the lawyers give you somebody you can blame. So we're good there.
So also a big thanks from the group for funding that market study, because that market study is going to get us connected with consultants who we've had enough discussions with them now. They know the business, they come in and say, not only how many beds do you need, but is it financially viable? Can you price the beds at this point, and is there enough population to do that, and is that enough to cover the cost of what would probably be a new facility? And most places that are looking at it say, if we're gonna do a nursing home, we wanna do other services probably associated with it, like memory care, assisted living, that kind of stuff.
Illinois Medicaid, though, is a very bad payer, isn't it?
Terrible, yes. Right.
Well, thank you all for that
Thank you.
update, and thank you for everyone's done everything on that. Our next agenda item is any other business. Does anyone else have any other business to bring before the board? Any public participation on non-agenda items?
Public, where are you?
No, but I do know how to make money at a nursing home. No Medicaid.
Yeah, that's right.
Medicaid,
That's right.
May I ask you to be part of this group? Anything else, anyone? Our next meeting is June 25th. Again, that's been rescheduled from June 18th to June 25th at 5 o'clock. We will be entering into the budget phase again, so, you know, as we get to the June meeting, August meeting, those will be a little bit longer meetings, so just to put it on everybody's radar.
I will be out of town on June 25th also.
So let's see, so you'll have one, is anybody else gonna be out of town on June
I don't
25th?
anticipate. It's always the reason you changed it was the same issue.
We did, because we had several people who couldn't make it on the 18th, so we moved it to the 25th.
You should move it into July, or why don't you want us,
The next week would be 4.
but then you can do it this weekend. But you will very deeply into the vacation schedule again.
That's my problem.
Well, we'll see when the agenda comes out, if there are other items. I mean, how does everybody feel about it? I mean, the alternative is that the next week takes us into July 4th, week of July 4th,
We probably want to skip that one.
right? And then
The one after that.
the second week of July.
Week after that, I'm at camp, so I'll be not available.
July 4th is on a Thursday. The 9th is a Tuesday.
Say we don't have a quorum.
We will if everybody's here, outside of Vern and Kat. But we would need, I believe we have to have 5, correct? 5?
Five.
We might have a new member by then, so.
Oh, the county board member. Do we know who that's gonna be, as Kyle said?
We'll get a letter one of these days and move forward.
Well, it also is a meeting that if we didn't have a quorum, you we could still get a lot done because the voting has to happen in August, so, for the budget.
Right. So June's kind of like the preliminary bring forward.
Yeah.
That's what I'm saying, okay, at least we'll make sure that that's out there, and if there are things, yeah, if we keep it the same date, we certainly want, Kathy, Dr. Bradley's, input on any budgetary things you would like to see in there, because that's what we'll be letting, Mandy know so that she can create it for August for us. So we'll have budget discussion in June for vote in August.
Won't be a waste of time.
All right, okay, then I guess the last thing is to entertain a motion to adjourn.
So moved.
Move, okay, move seconded, all those in favor?
All right. Vote with your feet.
Thank you, everyone, and
Thank you for picking us for the mobile unit.
Well, you're welcome.
Eddie's gonna come pick it up.
Yeah, he can just come in anytime and we'll get him over to finance. Just have him come in and ask for me or
Oh, yeah.
somebody